Time for today's injury report. It's being brought to you by Cape Regional Health System and Dr. Kevin McHale. Cape Regional Health System and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. And we always hope that we don't have to talk about the Philadelphia team injuries, Doc, but unfortunately, 3 guys on the list this week and some major injuries. Welcome back.
Yeah, I'm glad to be on. Not so happy to be talking about all these Eagles. I like it better when we're talking about devastating losses to my fantasy team, not all-pro tackles. So.
Nope, and let's get into the all-pro tackle. Jason Peters, we know he's done for the year, but he's 35 years old. An ACL, an MCL. Could he be done for his career?
Yeah, ACL and MCL injuries are obviously really serious injuries. And we watched the play on Monday night where that 300-pound defensive lineman fell on the outside of his knee, pushing that knee in. And that is a typical pattern for that MCL tear. But typically, when you have that type of force come across the knee from the outside in, putting that knock-knee pattern, it usually just tears the MCL. And that's a much shorter term. You put them in a hinged knee brace, they rest for a few weeks and get back out on the field. But that secondary stabilizer to that type of force is your ACL, and clearly he had enough force going across there, not only towards MCL, but he toward the ACL too. So obviously season-ending and possibly career-ending. At the age of 35, he's pretty much elderly to be in the NFL, but he's got the skill. And there's one thing that is going for him, and that's, actually James Andrews his group did a study looking at the return to play after ACL tears. And if you're for the more veteran players and the better players, a much higher rate of return to play, as you could imagine. We know he has a skill set to get back out there, but it's going to be difficult for him after 13 years in the NFL to see him back out there again next year.
Yeah, that age is interesting because the Eagles did give him that contract extension, so we'll see how that all factors in here. When you have the 2 injuries at the same time, does that make it a longer time frame to return and get himself back rehabbing?
So in general, yeah, it can add some time to the rehab. So if you had to pick an additional injury to your ACL, you would want to pick the MCL. There's 4 major ligaments in the knee. You got the LCL, which is on the outside, the MCL, which is on the inside, and then your ACL and PCL are kind of right in the middle of the knee that play a role in kind of stopping that back and forth motion going forward and backward. But the MCL actually doesn't require a huge additional treatment. A lot of times you can just fix the ACL with the surgery and put somebody in a hinged knee brace and the MCL will still actually heal. Every once in a while, though, if it's real severe and it's pulled off the bone real far, it does need to be surgically repaired. That being said, the MCL shouldn't actually extend the duration of his rehab that much, although it clearly is going to add time to his rehab. But it's not quite the same as that injury that Teddy Bridgewater is just going through right now, where he's that multi-ligamentous injury with a knee dislocation, much more severe, obviously led to a much lengthier recovery. This is a little bit more on the milder side, but clearly more severe than just your typical ACL.
Okay, Dr. Kevin McHale, Cape Regional Health System with us. Let's go to the Jordan Hicks here, an Achilles tear, and we've talked a little bit about that with Sidney Jones in the past, but this one here happens, it's his second one. He had one on his other leg, his right leg in college. Now he gets one on the left leg here. This guy, he was interesting because he had some injury issues coming into the week, and you wonder if he admitted that he hurt his ankle compensating for a calf injury that he had, and you wonder if some of that stuff all ties into, the Achilles kind of giving out on you.
Yeah, it absolutely can. So we know in general when you have an injury, you're trying to compensate for it somehow, and by doing that, it kind of throws off your mechanics a little bit. And as a result, you can put some extra force in other areas that can lead to additional injury. We know players that are fatigued or they have another injury that they're compensating for have higher risk of injuries to other joints and areas of the body. So it absolutely could play a role. And it's really, really unfortunate. We were talking about Fletcher Cox a few weeks ago with the calf strain, and that's, a much more, benefit, like a much better injury to have. He was only out for a couple weeks, but when you tear that tendon at the bottom where those calf muscles converge and kind of attach to the heel, it plays a major role in that push-off strength that you need to compete and run and sprint. So, and it's a much lengthier recovery and healing process. So, he'll be getting that surgically repaired, and it'll be at least a 6-7 months recovery like we're seeing with Sidney Jones.
Yep, unfortunate for Jordan. And again, this is the second time this has happened to him. And I guess sometimes it's common, too. When you do one, you see a lot of guys do it again.
Yeah, so in general, a lot of times these injuries are in athletes usually a little bit older than Jordan. Usually, a 29-year-old is kind of the average age for an Achilles rupture in the NFL. And it's because there is some wear and tear, and you can have some underlying tendinopathy or some wear and tear of that tendon that puts you at risk. And then that one game, when you put that extra force on the tendon, it tears and ruptures. So in his case, he clearly had so whatever mechanics, he was overusing that other side like he did in his junior year of college. And the same thing happened, unfortunately, this season.
All right, now this one is tough to get a grasp on because there's not an actual injury, but Markelle Fultz, shoulder injury. The original story, Doc, was that he had fluid drained out of the back of his shoulder. Then there was a change in the story that basically said he got a cortisone shot that helps with inflammation. Can you tell us what would be more severe, getting the shoulder drained or getting the cortisone shot injected? And if you were doing something like this, what are some of the possibilities that could be wrong with this guy? Because if you watch him, he doesn't look right.
Yeah, so I think what likely happened, there was just a miscommunication there with the trainer kind of reporting the wrong thing, or the agent there reporting the wrong thing. In general, with shoulders, it's much more likely that it was a cortisone injection and to begin with. We drain fluid off your knee quite often. You end up with large, what we call fusions, or a lot of swelling in the knee joint that you can pull fluid off. The shoulder, you can still get swelling in the joint, but it's much less common to actually have that fluid pulled off. The cortisone shot, though, on the other hand, is a very common treatment. It's a common treatment for things like tendonitis. In overhead athletes, your basketball players, your baseball players, quarterbacks in the NFL, swimmers, they're at a high risk of overuse injuries in the shoulder. And one of the most common ones being rotator cuff tendonitis, which is a common reason to give a cortisone shot to the shoulder. So the interesting thing is when I talk to, parents of young athletes and coaches of young athletes, and I'm telling them about ways to pick up on the fact that a kid might have an overuse injury, I tell them to watch their performance. If their performance starts to decline, maybe it's a pitcher losing velocity, losing accuracy. In Fultz's case, it's obviously his shooting technique, which is clearly off. That's a sign that there might be an injury in the shoulder, and that's got to be picked up on because you really, especially a young guy like him, getting just started and this early in the season, there's no reason to be playing through an injury like that if it's really throwing off your form. So, that's something that should be picked up on and giving them some time to rest to get over this.
Yeah, the quote from the agent was he literally cannot raise up his arms to shoot the basketball. If I came to you and said, I maybe I'm not experiencing pain, but I can't raise my arms up to shoot the ball, what would be the initial thing that would trigger you off?
Yeah, you watch him, he can't get his arm up over his head. He brings his arm up, he pauses at 90 degrees, and then tries to shoot over his elbow. It's like, I have a better shot, and that's saying something. So in general, when you have that type of painful range of motion, you really shouldn't be out there. We use some kind of general rules of thumb. You need to have full painless range of motion of a joint. You should have about 80% of your either pre-injured strength or compared to the your other side, at least 80% of the strength of the other shoulder. And you should be able to do sport-specific activity painlessly. So, shooting a foul shot should not cause a professional basketball or ball player pain. If he's having pain with something as simple as that, then he's not ready to be on the court playing at a much higher level. So, once you see something like that, that kid's going to need to be pulled off the court. He's going to need some rest. You get studies, whether it may be an MRI. Sounds like there's no structural damage, which is great, meaning that there might not be a tear.
Yeah.
But he clearly has an overuse, a lot of inflammation of the tendons, likely a tendonitis, and needs time to rest and rehab.
So does 3 games sound normal, or does that sound optimistic?
I think that sounds pretty optimistic. I wouldn't be surprised if we see him out longer. It's funny. We're talking about limiting minutes for Embiid, who's finally healthy, ready to go. He's chomping at the bit to get out there more, and they're holding him back. And now they have Fultz playing through an injury. It's kind of interesting. We're not on the sidelines there, so we're not part of these decisions. But I don't know if he's going to be ready to be back to play in 3 weeks. I would not be surprised if he's out longer than that. I'm sorry, not 3 weeks, 3 games.
Yeah, 3 games would be Monday, I believe.
About a week or so. And a few weeks might not be surprising.
Interesting, and you have been on a sideline before dealing with injuries. Dr. Kevin McHale now with Cape Regional Health System and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. And, of course, we take a look at all the major injuries. There was a lot this week. We had the Hightower injury. I think he tore his pec. You had the broken arm out there from Carson Palmer. So every week
got put on the IR today, by the way.
Oh,
Carson
did he?
Palmer did,
All
yeah.
right. How about that? So, Doc, we always appreciate you clearing up some stuff, and those Sixers always give us something to talk about.
Yeah, unfortunately. They're going to keep us busy all winter, yeah.
Unreal. All right, Doc, we'll talk to you next week, pal.
All right, I'll talk to you soon.